Hello, my name is Devon Paciello. I'm just going to share my screen so you could see the presentation. Can everyone see my screen?
Okay. See, it looks good.
Okay. Okay, so today we're going to be talking about Parkinson's disease. As we were just introduced, my name is Devon. I'm an occupational therapist at Valley Hospital Outpatient and Inpatient Rehab. Hannah is the physical therapist who'll be presenting, and Meredith is the speech language pathologist. Today we are going to be going over the history of Parkinson's disease, how it happens and some of the symptoms, and the focus will be on therapeutic treatment and research with an emphasis on LSVT BIG and Loud. And at the end, we'll have time for questions and answers. Dr. James Parkinson published an essay on the shaking palsy in 1817, which established Parkinson's as a recognized medical condition. The essay was published on April 11th, which is now considered World Parkinson's Day. So how Parkinson's occurs is it's a neurodegenerative disease that affects dopamine-producing neurons in a specific area of the brain called the substantia nigra. Dopamine is a chemical messenger responsible for transmitting signals within the brain that allow for the coordination of movement. When dopamine is affected, individuals are less able to control or direct their movement. So this picture shows dopamine levels in a normal neuron and then someone with Parkinson's. So the lack of dopamine to receptor cells results in a loss of coordination and reduction in movement. Furthermore, there is decreased control of movement, and often Parkinson's patients use small movement. For instance, small steps and small handwriting, and their speech often becomes soft. Regarding motor symptoms for Parkinson's, it includes bradykinesia, rigidity, tremors, postural instability, and speech and swallowing difficulties. Bradykinesia refers to slowness of movement. Rigidity refers to stiffness that contributes to decreased range of motion. This is commonly seen in the trunk region, and tremors tend to occur in the hands. Postural instability refers to lack of balance and increased falls risk. Additional motor symptoms include gait complications and freezing movements. Freezing movements are like the spontaneous inability to move. Some non-motor symptoms include cognitive effects, psychological, sleep disorders, and loss of smell. So now we're going to go into research and treatment regarding Parkinson's. A recent article examined the effects of multidisciplinary intensive rehab treatment in early Parkinson's disease. The results suggest that multidisciplinary intensive rehab might slow down the progression of motor decay, delay the need for increasing drug treatment, and it might have a neuroprotective effect. So this graph below depicts L-DOPA dosages, which is the common medication used for Parkinson's treatment throughout a research study. So as you can see, the L-DOPA dosage increased significantly only in the control group. So this study is great support for therapeutic intervention. So this top graph is they didn't receive the treatment. So as you can see, their medication had to go up and up to monitor their symptoms, where in the control group, they were able to maintain pretty much steady. One evidence-based intervention that allows all disciplines can use is the Lee-Silverman voice treatment Loud and Big. Numerous studies have been published regarding the benefits of this therapeutic intervention. LSVT is a relatively new treatment approach that involves the concept of neuroplasticity. This approach addresses the internal aspects of Parkinson's disease symptoms leading to functional improvements. Articles have shown that LSVT BIG therapy may improve postural control, gait, dual task performance, reduce fall risks. Furthermore, it can be used for other neurological conditions, which is great as well. So LSVT Loud and Big are the two components of this intervention. So LSVT Loud is delivered by a certified speech language pathologist. LSVT BIG is delivered by a certified physical or occupational therapist. Both Loud and Big have fundamental components regarding their target, mode, and calibration. Regarding target, there is a singular focus on amplitude, which is the common rehab goal. The mode for this intervention is intensive and high effort. Intensity is important for neuroplasticity. Intensive and repetitive practice drives neuroplasticity and changes the brain. Regarding calibration, there's a key focus on generalization. The goal of intervention is for exercises to carry over and be generalizable to everyday function. So function is key, and therapeutic treatment and exercise must be linked to everyday tasks. So this photo illustrates the amplitude goal for LSVT Loud and BIG. For speech, patients should transition from soft to healthy vocal loudness. For movement, patients should transition from small to a big, healthy amplitude. So for the general treatment outline, it is 4 days a week for 1 month. Each session is individual and lasts 60 minutes. The focus in sessions is intensive and repetitive practice. Throughout treatment, patients are provided with auditory cues as needed to speak louder or move bigger. Numerous studies have been done on the positive effects of external cueing to enhance motor and communication performance in Parkinson's patients. Additionally, throughout the 30 days of treatment, patients have daily homework and carryover tasks, which we will discuss later on in this presentation. Okay, I'm going to play a video next that kind of goes over LSVT BIG. Let me know if you're not hearing it or seeing it. One second.
I couldn't get out of a chair by myself. I was having trouble doing everything.
Big steps. Good. BIG is a research-based exercise approach. It involves big movements, teaching patients that have Parkinson's disease how to move big. And the goal of the program is to make people move bigger, take bigger steps, have better balance, improve their trunk control and flexibility.
Other than going to exercise and going to water aerobics, which I didn't do, but this was something different, and he didn't call it exercise, he called it physical therapy, which intrigued me.
We have seen tremendous results in patients' ability to walk better, get out of a chair better, get in and out of bed better, get in and out of a car easier, and perform their self-care activities easier.
Without this, I probably would still be in my recliner or on the couch or in bed, not able to do for myself. But now I can dress myself again. I can walk, and sometimes I walk like I look like I'm drunk, but I, can walk and open doors and get up out of chairs by myself.
LSVT Loud was teaching people to exaggerate their voice volume so that they could be heard at a normal tone of voice. And the therapist, Becky Farley is her name, who's a PhD physical therapist, took that research and incorporated it into big movements, working as well as big, loud talking.
20. 1, 2, 3. Marguerite is wonderful, and she sits in front of you, and she goes through, and that's okay, rest, or she'll tell you to rest, or she'll wait with you and work with you and make you do what she wants you to do. And it's in a special way that she does it. It's in a special sequence. I have Parkinson's disease, but Parkinson's disease does not have me.
Okay, Hannah, our physical therapist, is going to take over from here on.
Hello, everybody. Oh, hang on. I'm just going to mute Susan's. Hang on one second. Okay. Hi, I'm Hannah Dial. I'm a physical therapist up here in Mahwah at the Valley Lifestyles building. So I'm going to jump in right now and talk about the LSVT BIG protocol. It has 4 components. First, maximum daily exercises, which are multi-directional large movements that challenge balance. The goal is for patients to learn the right amount of effort to produce normal movements and to override those slow movements. Through performing these daily exercises, patients will begin to normalize the size of their movements. Second, we practice walking big. Walking big is practicing big stepping and arm swings over varying distances and surfaces. And you saw a little bit of that in the video. Lastly, functional component and hierarchy tasks are individualized to personal needs. Briefly, functional component tasks are parts of movement that give patients difficulty and that are practiced in each PT session. An example would be getting up from a sofa or turning in bed. Hierarchy tasks are driven by patient goals and usually consist of complex activities such as golfing, cooking, or dancing. We will go into these into the next few slides. So here we have the maximum daily exercises performed in the LSVT sessions, as well as a part of the LSVT homework. They look a lot like they sound. So we have floor to ceiling, which I believe is on the slide here. Side to side, which is seated, reaching out to the side. Forward stepping, which is just a big forward step. Backward step, which is a big backward step. Sideways step, which is a big sideways step. Forward rock and reach, which is like a reach up towards like a cabinet or a ceiling. And a sideways rock and reach, which is a rotational rock and reach. And then lastly, sit to stand. Those exercises can be adapted to all levels of ability, sitting or lying down. The goal of the exercises is to help with bigger movements in everyday life. For example, the floor to ceiling can be linked to bending down to put on your socks and shoes or pick up something off the floor. The sideways step exercise may help with lateral stepping in a movie theater, these types of things. So then we have the functional component tasks, which are the simple one-step movements that may be challenging to the patient in everyday life. Examples include picking up coins, answering a cell phone, putting on a shirt over your head, or standing up from a chair. They're simple one-step movements. And during our sessions, the patient performs 5 repetitions of each movement, and they remain consistent for the 4 weeks of treatment. Then we have hierarchy exercises, which are multi-step functional activities chosen by the patient based on their personal goals. So some examples include playing golf, cooking, dancing, or taking care of pets. These activities and goals can change from session to session depending on patient preference. The ultimate goal of LSVT BIG training is for patients to use bigger, more normal movements automatically in everyday life. For instance, by performing that rock and reach that I was talking about, this patient would be better able to reach in the cabinets for meal prep ingredients or reach for a book, those types of things. So that long-term carryover. So now I'm going to discuss specifically what we here at Valley do in regards to PT management for patients with Parkinson's disease. So firstly, who are physical therapists? We are movement experts who improve the quality of life through prescribed exercise, hands-on care, and patient education. We can help you move more efficiently through specific exercise, stretching, and impairment-based training, such as LSVT BIG. So there are 3 key elements in the management for patients with Parkinson's disease. First, the promotion of an active lifestyle and long-term commitment to exercise that the patient enjoys. Second, a prescriptive exercise plan, including aerobics, resistance training, balance, and stretching. And lastly, task-specific training, which includes the LSVT BIG program. So, an active lifestyle. I believe that the diagnosis of Parkinson's should come with a pair of sneakers. As Devon mentioned previously, studies show that there are neuroprotective effects for patients with Parkinson's disease adhering to an active lifestyle. So the exercise plan should be fun and meaningful to the patient and address impairments such as stooped posture, balance, and decreased flexibility. Examples of exercises that may be enjoyable and beneficial are listed here: walking, hiking, biking, boxing, strength training in the gym, dancing, and Tai Chi. Of course, this is not an exhaustive list, and the most important thing is finding an activity that you enjoy and that you can maintain a commitment to. So this is an example of a recommended treatment prescription for patients with Parkinson's disease. It includes approximately 150 minutes of aerobics per week, which is 5 times a week for 30 minutes each. No one form of aerobics is better than another. However, there is research in supporting treadmill and recumbent biking having positive effects on this population. Strength training should focus on lower body muscles such as gluteal and back muscles. Examples include like the leg press machine and a chest fly. Stretching should focus on spinal extension, hip flexors, hamstrings, calves, and pectorals, and should be held for 90 seconds each. And finally, balance training should be performed 2 to 3 times a week for 30 to 60 minutes at a time. And it can be modified to include Tai Chi yoga and then the LSVT BIG activities, as well as balance specific drills. And then finally, we have task specific training, which is where we use the LSVT BIG exercises, such as the maximum daily exercises, as well as big walking, functional component tasks, and hierarchy tasks. We practice high repetition of specific practice of relevant daily tasks, such as sit to stand, walking, pivoting, bed mobility. PTs use verbal and visual cues to facilitate the movement. Sometimes we use a metronome or music with a strong beat, which can help patients take bigger steps within the rhythm. We also can use visual cues such as lines on the floor, or sometimes I like to use a sports ladder to help patients take bigger steps and more even steps. We can progress gait training or walking training by asking a patient to walk and carry an object, walk and tell us a story, walk and count backwards from 100 by 3, or walk and name animals that start with the letter P. These are just examples. These activities are considered dual task training, which require cognitive component along with the movement. So this concludes the general PT portion of the presentation of how we would treat patients with Parkinson's disease. At the end of the presentation, if you have any PT questions, even outside of Parkinson's, please feel free to ask away, I'll be here. And now Devon will talk about the OT treatment details.
Hello, I'm gonna go over occupational therapy treatment a little bit. So what is occupational therapy? Occupational therapy helps people across the lifespan do things they want to need to do through the therapeutic use of daily activities, which we call occupations. Occupational therapy practitioners enable people of all ages to live life to the fullest by helping them promote health and prevent or live better with injury, illness, or disability. Some examples of specific OT interventions include fine motor training to improve dexterity with daily tasks. So activities of daily living training, such as dressing, bed mobility, simulated tasks, such as cooking. Cognitive training, we also try to connect it to functions, so money management or memory strategies to help you when you go to the grocery store. Other specialty areas include vision training and rehabilitation. And then we also do physical exercise via strengthening or endurance to improve task performance. So one thing we get asked a lot as occupational therapists is if LSVT can help with small movements. Can LSVT BIG help people move even small movements a little bit bigger? And the answer is yes. So recent research has revealed that LSVT BIG can improve fine motor control and dexterity in Parkinson's patients. A research article on handwriting in Parkinson's patients found that providing visual cues such as like dots and auditory cues like write big resulted in an increased writing amplitude. Improved writing persisted after the intervention ended. Additionally, a 2018 report found that LSVT BIG intervention patients demonstrated improvements in balance, gait, strength, range of motion, and finger dexterity. Finger dexterity was correlated to tasks such as cutting food, handwriting, and managing clothing fasteners such as buttons and zippers. So this slide goes over an example of LSVT BIG targeting fine motor control. So your maximal daily exercises, walking big, and homework will remain the same. However, we could modify and pick those functional component and hierarchy tasks to really work on that fine motor control. So some examples for like the functional component tasks, which again are those singular movements. It could be buttoning, like one button, applying lipstick, handwriting a name, picking up coins, pulling a zipper up and down. And then the hierarchy exercise would be more of a functional full task. So like handwriting a full passage or a long passage, dressing with buttons, zippers, and buckling, applying a full face of makeup, or even like cooking a whole meal. Here are more examples. So a functional component task of cutting could correlate to a hierarchy task of being able to cook that whole meal, We also have a functional component task of sorting money with a hierarchy task of being able to use the ATM without as much difficulty. Two more examples, we have a functional component task of moving checker pieces to a hierarchy task of being able to participate in family game night. Another example is a functional component task of painting brush strokes to a hierarchy task of being able to paint a full picture. Another thing with LSVT BIG is to enhance fine motor control. It is important to instruct patients to be aware of their hand posture. A lot of times while performing these daily exercises or just throughout the day, Parkinson's patients maintain a closed hand position. So you want to educate patients to focus on sustained big hands throughout exercise. Additionally, there's something called finger flicks that are commonly integrated into treatment that I could show you later. These next few pictures, here's just, I'm circling. So here you see like more of the closed hand, and then on the other side, you see the big sustained hand position. Here are a few pictures of pre and post-test writing improvements with LSVT BIG. As you can see, the amplitude and just spacing improved and clarity improved. Here's another one. As you can see, the pre and post, overall improved amplitude and improved legibility. So what do you need to start LSVT BIG? What you need is an MD prescription along with clearance for LSVT BIG. And then it must be administered by a certified provider, occupational therapist, or physical therapist. We're going to watch one more video. This is David's story. He completed LSVT BIG. Let me know if you could hear it okay once it starts. Can you hear it?
We don't hear it yet. Oh, no, I do.
Was getting the idea I was going to have to limit my amount of working in my wood shop that I was going to do because I wasn't going to be able to do it. When you're working with a table saw or anything, if you try to hold that and this hand is shaking, and to try to operate something like that with one hand doesn't, you just asking to get your fingers cut off. And thanks to this program, I can do just about anything I want to in there. I'm really happy with what the results.
Sessions are an hour long, and the patient is pretty much moving the entire hour, so it's intensive. It's there isn't really much time for sit down rests. We keep going for that whole hour, and while there is a protocol that we follow, we also do have a lot of leeway within that protocol to kind of tailor the program to each individual patient's, lifestyle, their hobbies and things like that. So everyone will do the same daily exercises, and we focus on big walking and things like that, but then we can tailor some of that so that we're incorporating things that are meaningful to the patient.
We did all kinds of work in both hands, remembering that I gotta flip that to stop shaking so that I can work with that hand, and exercises to get both arms and leg working at the same time. One that I watch all the time, Sarah, she's special. She says, "Walk, big Papa." This is part of my life I wouldn't miss for anything. I think anybody that would get in this program and be sincere about it, they would definitely benefit from it. Definitely.
Okay, that concludes the occupational therapy portion of this presentation. Again, at the end, I'll be able to answer any questions. We're going to switch over to Meredith, our speech language pathologist, to discuss more about Parkinson's and LSVT Loud.
Okay. Hello.
One second. Can everyone see the new presentation screen?
Okay. Hello, everyone. I'm Meredith Rosenberg, and I'm one of the speech pathologists here at Valley Hospital. I've been certified in LSVT Loud. I'm actually going to switch seats a second. I've been certified in LSVT Loud for about 15 years, and I've been working as a speech therapist for about 20. As you see from the first slide, over 89% of individuals with Parkinson's disease suffer from voice and speech disorders. So here at the next slide, here are some of the symptoms of speech and sometimes swallowing difficulty with Parkinson's disease. People present with a low vocal volume or soft voice, breathy sounding voice, or sometimes even a hoarse voice, slurred speech or mumbled speech. And with the swallowing difficulty, people may have coughing while eating or drinking, sensation of food sticking in your throat, and sometimes these difficulties lead to an aspiration pneumonia. So how Parkinson's also affects communication. Parkinson's creates a mismatch between how you think you're talking and how you actually sound. So this might mean you think you're speaking at a normal level, meaning at a normal volume, but family and friends are constantly asking you to repeat yourself. You actually might be speaking softer and lower. So oftentimes it's a good idea with this type of diagnosis to ask family and friends, have they noticed changes in your vocal loudness? Using something like an LSVT Loud strategy might feel like you're shouting, but actually family and friends say you sound normal. So again, it's creating not just muscle memory for strength, but it's also calibrating you and making you used to this normal way of speaking at this normal volume. So we talked about swallowing difficulty a couple slides ago, or dysphagia, that's the medical term for swallowing difficulty. Sometimes people may notice this where it turns into a pneumonia, or again, it's that family saying you're coughing every time you're drinking, or you're feeling something stuck in your throat. Consult with your doctor or a speech language pathologist for a swallowing test. And what we do is we work together to determine the need for instrumental swallow studies, such as a modified barium swallow study. What that is, it's an instrumental swallow study conducted in radiology with a speech pathologist and a radiologist. And it's a dynamic image, meaning we're making a motion picture of you swallowing. So we mix a little bit of food with barium, a little liquid with barium, because that's what shows up on the x-ray. And we're looking to make sure that nothing's going down towards the lungs or the wrong tube, and to make sure that things are going down the right tube, the swallowing tube. Going back to what LSVT is, it's the Lee-Silverman voice treatment, LSVT, and it's built on 3 key strategies. One being target. For loud, we're targeting vocal loudness. The mode, like with BIG, is intensive dosage and high effort that encourages people to always achieve more by working harder. And calibration is the word that we use for generalization, so that you're not just led in our therapy office, but you're able to use these strategies in life. So research on LSVT Loud began all the way back in 1987 with an actual patient named Lee Silverman. And research is ongoing, and it shows that this strategy shows improvements in vocal loudness and intonation that last for at least 2 years post-treatment. Improvements have been shown in articulation, so again, how you're speaking, facial expression, speech intelligibility, meaning are people understanding you, and even has an added benefit for swallowing. What do I need to have LSVT Loud? Well, we need a prescription from the doctor for speech therapy, and typically you'll be evaluated by the speech therapist. Prior to the start of this LSVT Loud program, we like you to get examined by an ear, nose, and throat doctor. We just want to make sure, since we're using a high intensive voice therapy, that they examine your vocal cords to make sure that you don't need to receive treatment for any other sort of difficulty with the vocal cords. When should I start LSVT Loud? It's never too early to begin LSVT. Treatment with LSVT Loud before even noticing changes in communication may help you keep your voice and speech strong for years. So like with BIG, it's 4 times a week for 4 weeks. Each session is 60 minutes and it's led by an LSVT certified speech language pathologist. Our focus is think loud to increase your vocal volume. So this does not teach you to shout, but again, it's working on these exercises to create muscle memory to get that loud voice again. And a lot of homework. Homework is daily for all those 30 days. So I'm going to go through a little bit of some of those exercises. Our protocol starts with a sustained ah sound using that think loud voice. So I'm going to do it for you. And as an example, it's ah. So my mouth is open wide. I got that loud voice doing it. I didn't hold it as long as I could, but the goal is to get you to keep that loud voice and to hold it and increase the amount of time that you're able to support that loud voice. Exercise 2 is another ah exercise, but this one is increasing pitch, meaning getting a little higher. So it sounds ah, all the while using that loud voice, but changing just that pitch. Now we're going to do that exercise going down in pitch, so we get a little pitch variety. Ah, again, with that think loud voice. Exercise 4 are 10 functional phrases that we design in therapy together. They may be something that's personal to you, things you enjoy, things you say to family members. Oftentimes we start with a, hello, my name is Meredith. And it can be something as, I like to play golf, or even what's on TV tonight. But these are 10 short phrases that don't change. Again, you see 15 times next to each of these exercises and 5 times for the 10 functional phrases. It's high repetition in order to reset that muscle memory. Going on to exercise 5, this is our hierarchy-based task, using that think loud voice. In week 1, again, we have those 4 therapy sessions for each week. Week 1 may start you on phrases using a loud voice to a shorter sentence. Week 2 might get a little bit longer of a sentence. 3 is even a longer sentence, probably about 10 words or so, and going into some short paragraphs. And week 4, in your final week of therapy, we tend to cover longer paragraphs to generalizing to conversation, again with that think loud voice. Carryover. So even from session number 1, we are talking about carryover. This is a technique that we want to set that muscle memory, but I want you using it outside of the room. So when you come into that session, I want to hear you using your loud voice greeting, whether it be our business associates at the front desks, greeting other therapists in the hallway. We oftentimes have you at home use it with family members, on a phone call with a family member, on a FaceTime with a family member. Even if you get your hair cut and you speak to the barber or the hairstylist, using that loud voice. Then in session, we tend to talk about, well, how was it? How was that party that you had over the weekend? And how was your voice able to sustain itself? Were you able to think loud the whole time? Did anyone have to ask you to repeat yourself? Just to sum up a little bit, after therapy is over, sometimes people need to get what we call a tune-up. So what that means is, when is the time for a tune-up? It could be any point that you feel like you're not able to sustain that loud voice anymore. Again, checking in with family or friends and saying, is my voice as loud as it used to be? We have a community of therapists to work with. So LSVT for Life, as you see that website at the top, is a good resource to keep up with these types of things. We also recommend practicing, even when you're done with LSVT Loud, about 10 to 15 minutes a day. And again, using that LSVT community as needed to check in. There's some exercises, some nice webinars, a nice community to keep you going. So here we're gonna go, excuse me, and see a video. Just bear with us a second. Okay.
Everyone could see the video screen. Okay, let me know if you can hear it.
Notice any changes in your speech or your voice? Yes, I don't speak loud enough a lot of times.
She's supposed to be mumbling.
Hoarse. I stutter, which I never did before. Do this for me, I would take a deep breath and say ah for as long as you can. Would you say Parkinson's disease has caused you to talk less? Yes. Because? Because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to them because they can't hear me. So I get mad and then yell. Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy? Oh, yes. What have you noticed? I talk louder. I think louder. I'm going to sing with the sound of the sons of my ears one of these days with my Good for you. That's excellent. What practicing do you do at home? My ahs, my highs, and my lows. And I read out the mail out loud. Yes. Do you feel like practicing helps? Oh, yes. Do you feel as though people can understand you all of the time now? Majority of the time, unless it's my husband, and he'll say, "Well, I can't hear you." Good for you. But I think he does that just to be cute. I think he does too. Has anyone commented that it's easier to understand you now? Oh yes, I sent some of our friends back when we went to their house and I talked about it. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?" Good. Don't you feel wonderful? Oh yeah, because now she can say, "I didn't understand what you said." No excuses, right? Yeah, no excuses. Right. So what do you do when you want to be as easy to understand as possible? Think loud.
Okay, I love this video. It is a beautiful example of the pre and post treatment. You could see how much better, you could hear how much better her voice is. And excuse me, it just shows that the therapy
Welcome to
works.
Fitness Friday. Oh, we are excited to be
Un
participating.
momento.
One
Think
moment.
Loud with LSVT Loud.
Sorry,
This
one
video
sec.
is being brought to you by LSVT Global, where we pride
It's
ourselves
this one.
in innovation and science.
Okay, I think we got it.
Share screen is paused. I just gotta share again. 1 second.
Okay. So again, just a beautiful video of what LSVT Loud does. To sum up, at our Goffel Road location, our LSVT BIG therapists are Devon, Paciello, Claudia, and Karen. At
505 Goffel. It's also myself for LSVT Loud and Olivia Bell. And at MAWA, Hannah and Danielle. So thank you very much.